In this lecture, we're going to look at the blood supply to the upper limb. So really it's going to be an overview of the blood supply. We'll look at the blood supply to the axilla, the arm, the forearm, and the hand. We'll look at the axillary artery, its three divisions and the various branches. We'll look at the brachial artery and its branches. We'll look at the ulnar and radial arteries, the branches that come off these, and also the anastomoses they form around the elbow. We'll then look at the blood supply to the hand and the superficial and deep palmar arches, how they're formed from the radial and ulnar arteries, and how they give rise to blood vessels that supply the digits. So here we can see we have a nice overview of the blood supply to the upper limb in this diagram. It is a right upper limb and we're looking at the anterior surface. And we can see that each upper limb is supplied with arterial blood that is coming primarily from either the left or the right subclavian artery. So here we can see above the clavicle we have the subclavian artery, and on the left hand side this is a direct branch of the aortic arch, and on the right side it's the bifurcation of the brachiocephalic trunk. The principal artery or arteries of the axilla are going to be the axillary artery, which we can see here. The axillary artery, as we know, is the direct continuation of the subclavian artery. And then it passes down into the arm as the brachial artery, and then this divides in the forearm to the radial and ulnar arteries. And then when we pass into the hand, we can see we have these deep and superficial palmar arches. So all of these blood vessels are originating from the subclavian artery. It passes down into the axillary artery, which then becomes the brachial artery. The brachial artery then bifurcates into radial and ulnar arteries, and here we have those superficial and deep palmar arches. So we're going to look at the details of all of these blood vessels. So let's look at the axillary artery. Remember, this is a right shoulder joint. We can see we've got pectoralis minor in position here. We can see we've got the clavicle, we can see we've got the humerus. And we can see entering into the axilla is the axillary artery. Over on this side of the screen, we can see the first part of the axillary artery as it's passing deep to the clavicle. And we're going to look at the branches that are coming from it. So, the axillary artery can be divided into three parts. Between the lateral border of the rib 1 and the medial border of pectoralis minor, we have the first part. And coming away from the first part is the superior thoracic artery. So here we can see the lateral border of rib 1, we can see here, and the medial border of pectoralis minor, we have the first part of the axillary artery. And really, coming off this first part is just going to be one artery, and this is the superior thoracic artery. Superior thoracic artery, as its name suggests, is going to supply the superior aspect of the chest wall. So it will apply the first and second intercostal spaces and also give blood supply to serratus anterior. If we then carry on passing down through the axilla, we can follow the axillary artery as it now runs deep to the pectoralis minor muscle. And the second part conveniently gives off two arteries. This is the lateral thoracic artery. So we have the lateral thoracic artery, and we can just about make that running underneath pectoralis minor here, the lateral thoracic artery. And as its name suggests, this supplies the lateral thoracic wall, especially serratus anteriorly. But also coming from the second part, posterior to pectoralis minor, is the thoracoacromial artery. In the diagram, we can see it's just slightly above pectoralis minor, and that's really for convenience, or the diagram becomes very confused. We can see that just above here, but coming from the second part, we have the thoracoacromial artery. The third part we can see is coming from below pectoralis minor. So as the axillary artery passes below pectoralis minor, this inferior or lateral border of pectoralis minor, we can see the axillary artery carries on. And the axillary artery finishes as it passes alongside the inferior border of teres major, where it then becomes the brachial artery. So as the auxiliary artery passes the inferior border of teres major, it becomes the brachial artery. But within these boundaries, the third part of the auxiliary artery gives rise to two circumflex humeral arteries. It gives rise to an anterior and posterior circumflex humeral arteries. We can see these running around the surgical neck of the humerus here, and these will anastomose around the surgical neck of the humerus. And it also gives rise to the subscapular artery. And we can see the subscapular artery running down in this direction. It's running down to supply the thoracic wall, but it also gives rise to a branch that's going back up here. And this is known as the circumflex scapular artery. We can see this running all the way over here in this direction. And later on, we'll see an important anastomosis of this artery around the scapula. But first of all, I just want to talk about the thoracoacromial artery. This is an artery coming from the second part of the auxiliary artery, deep to pectoralis minor. It is a short and wide artery that pierces the clavico-pectoral fascia, and it divides into four important branches. We can see it's coming off here. It's very short, it's quite wide, coming from the second part of the auxiliary artery. We can see we've got a clavicular branch, and if you remember looking at the clavicle in the first lecture, we had that nutrient foramen, and this is where the clavicular branch passes in to supply the clavicle. We can see it then comes away, and we have these pectoral branches that go and supply pectoralis minor and pectoralis major, the pectoralis muscles on the anterior chest, and we can see it then turns laterally and it goes towards the deltoid muscle. It has a deltoid branch, and it goes up towards the acromion, the acromial branch, where it can form again numerous anastomoses around the scapula. So the thoracoacromial artery coming off the auxiliary artery, coming from its second part. So now let's move down into the arm, and we can see on the diagrams here on the screen, we've got now the brachial artery. As the auxiliary artery passed the inferior border of teres major, it just became the brachial artery as it ran in the brachium, which is your arm. It runs down, and remember it's running alongside or adjacent to the median nerve we can see running here. And here we can see of a more posterior view, we can see that a more anterior view, close up, with some of the muscles being dissected. We can see the brachial artery here running alongside the median nerve, and we can see various muscular branches going towards brachialis and biceps. So the brachial artery begins at the inferior border of teres major. Like I said, a direct continuation of the auxiliary artery. It passes through the arm anterior to triceps and brachialis. So it's found in a cleft between biceps brachii and brachialis. So we can just about make out brachialis here, and here we have biceps, and it's running in a cleft between those two branches, two muscles. It gives off lateral branches, and these are numerous unnamed branches. These are the ones I referred to here, and they go to the muscles of the anterior compartment. Coming off laterally as well is the nutrient artery to the humerus. Like we had a nutrient artery to the clavicle, so we have a nutrient artery to the humerus. Coming away from its more medial aspect, we have profunda brachii, and profunda brachii is an important muscle as it supplies the posterior compartment. So we have profunda brachii. We can just about make out that passing here. We'll see that in greater detail when we look at the posterior compartment. But it also gives rise to some superior and inferior ulnar collateral branches, and we can see these coming here. We can see a superior ulnar collateral artery running down, and we can see a inferior ulnar collateral artery. And these arteries are important as they're going to form anastomoses around the elbow joint, and we'll see that when we look at the elbow joint in more detail. But some of these branches come from the brachial artery. These are the superior and inferior collateral branches. So now let's look at the posterior aspect of the arm and also the axilla and some of these scapular branches that I've been talking about. And here in the diagram, we can see the posterior aspect of the upper limb, its shoulder region and the humerus in the arm region here on the right upper limb. So we can see that the blood supply to this region is going to be from the third part of the axillary artery. We have the posterior circumflex artery. Remember, this one is passing through the quadrangular space. Here we have the quadrangular space. Remember the boundaries of the quadrangular space. Laterally, we have the surgical neck of the humerus. Medially, we have the long head of triceps. Superiorly, we have teres minor, and inferiorly, we have teres major. We have it passing out in this direction, passing towards the deltoid muscle. So we've got the posterior circumflex artery passing out alongside the axillary nerve within the quadrangular space. Then we can see we have this circumflex scapular artery. The circumflex scapular artery comes from the subscapular artery that we mentioned, and that runs over the posterior surface of the scapula. And we can see it's running over the posterior surface of the scapula, the circumflex scapular artery, and that's anastomosing with the suprascapular artery. And the suprascapular artery is running over that suprascapular notch that we mentioned in the first lecture. So we've got the suprascapular artery and we've got the circumflex scapular artery, and these are forming a complex anastomosis around the scapula. If we then look at branches coming from the brachial artery, then the most important one of these is profunda brachii. This is running alongside the radial nerve, and they leave the axilla by passing through the triangular interval, posterior compartment of the arm. They enter the posterior compartment of the arm by running through the triangular interval. We can see the triangular interval here. As it's running down the profunda brachii between the medial and lateral heads of triceps brachii, we can see it here. It gives rise to a series of collateral arteries. And these are collateral arteries. We've got a medial, we've got a radial collateral artery. We've got some anterior branches of the radial collateral artery here. These are all passing down to anastomose around the elbow joint. So they'll form important anastomoses around the elbow joint as they're running distally towards the elbow. And these are coming off the anterior and posterior radial collateral arteries coming from the profunda brachii artery. So now let's move into the forearm, and we see the direct continuation of the brachial artery. And as the brachial artery passed through the cubital fossa alongside the biceps tendon and the median nerve, we can see we have the brachial tendon, the biceps tendon here, got the biceps tendon here, and we can see we have the brachial artery, and we can see we have the median nerve. As it passes through the cubital fossa, the brachial artery is then going to divide into a radial artery and into a ulnar artery. So we're looking at the anterior view of the forearm of this right upper limb. So the ulnar artery. The ulnar artery, we can see it here, is going to pass anteriorly through the forearm compartment, passes in the anterior compartment of the forearm, it passes deep to pronator teres, and it runs alongside, we can see it here, flexor carpi ulnaris. It runs alongside flexor carpi ulnaris, and it's running alongside the ulnar nerve as well. So we can see the ulnar artery here, and it's going to run along the deep compartment down alongside flexor carpi ulnaris. The radial artery, that is also going to pass within the anterior compartment, but it runs deep to brachioradialis. So here we can see brachioradialis muscle, and the radial artery is running deep to brachioradialis muscle. It exits the forearm by passing laterally around the wrist, and it enters the anatomical snuff box, as we mentioned. So here we can see it in a bit more detail. We can see we have the radial artery as it's passing down deep to brachioradialis, ultimately going towards the hand, and we can see coming off it we have a recurrent radial artery that's passing upwards. And this is going to form an anastomosis with what we can see is the radial collateral artery. So here we have an anastomosis formed from the profunda brachii artery and from the radial artery. This anastomosis running up here. We can see we have some important muscular branches passing towards the musculature within the anterior compartment, and on here we can then see we have the ulnar artery. We can see the ulnar artery running down here, and you can see it's giving off various branches. We can see we have the ulnar recurrent artery, and that's going to pass back up in this direction, and we can see that clearly on here, the ulnar recurrent artery passing up in this direction. And we can follow the ulnar artery as it passes all the way down within the anterior compartment, accompanied by the ulnar nerve. We can see it's accompanied by the ulnar nerve here, and we can see it's giving off various branches. We have a posterior interosseous artery here, and this is going to pass through the superior aperture of the interosseous membrane, and this is the posterior interosseous artery. So we have numerous anastomoses around the elbow joint, from the radial artery and from the profunda brachii. The radial artery gives rise to the radial recurrent artery that passes upwards, and the profunda brachii gives rise to radial collateral arteries that pass downwards. So we have them coming down here. We have the radial collateral arteries coming down, and we have the radial recurrent arteries passing up. With regard to the ulnar, this gives rise to anterior and posterior recurrent arteries that pass upwards, and coming from the brachial artery, we have inferior and superior ulnar collateral arteries that pass downwards. And we can see these coming up in this direction and then coming down. So these are forming important anastomoses around the elbow joint. These anastomoses are really important. So if some of the arteries get blocked, there's a mechanism for compensation to occur. It's not that significant if some of these branches get damaged or get blocked because there's an alternative blood supply. We have other branches that are coming from the radial and ulnar arteries. So the ulnar artery will give rise to a common interosseous artery, and this interosseous artery then gives rise to anterior and posterior interosseous branches, and these run either side of the interosseous membrane. So here we can see we've got a common interosseous artery here, and the common interosseous artery is then going to, we can see here, dive through the interosseous membrane, and that becomes the posterior interosseous membrane. The anterior interosseous membrane artery is now running deep down in here alongside the interosseous membrane, supplying the deep muscles within the anterior compartment. The radial artery, that's going to give rise to dorsal and palmar carpal branches as they go towards the carpal bones, and we also have these coming from the ulnar artery, dorsal and palmar carpal branches, and these form a nice carpal anastomoses around the carpal bones in the wrist. We'll see these later on. So now let's move to the hand and the blood supply to the hand, which is really formed from the radial and the ulnar artery forming deep and superficial palmar arches, which we can just make out on this diagram here. So we'll talk about the palmar arches. So all the arterial blood to the hand, like I said, is supplied by the radial and ulnar arteries. And they form two palmar arches that run across the central compartment of the hand, superficial and deep. If we just look at the ulnar artery, first of all, then the ulnar artery, we can see, enters anterior to the flexor retinaculum. Remember, it's running in Goyon's or the ulnar canal. It's running between pisiform and the hook of hamate. It's running into the hand. We can see it's giving rise to its palmar and dorsal carpal branches here. And then as it progresses towards the central compartment of the hand, it gives rise to the deep palmar branch. So we can see that the ulnar artery is then giving rise to the deep palmar branch that goes around here. But the main trunk of the artery carries on, and it passes superficial to the long flexor tendons, and it forms the superficial palmar arch, which we can see here. So it enters, it gives rise to those carpal branches, it then gives rise to a deep palmar branch, which we'll come back to in a moment, But the main trunk of the artery carries on and it forms this loop, the superficial palmar arch. The superficial palmar arch will ultimately become the superficial palmar branch, which is coming from the radial artery. And here we can see we have a complete anastomosis. Superficial palmar branch here, coming from the radial, is uniting with the superficial palmar arch. And we can see that running superficially within the hand. This artery gives off 3 common palmar digital arteries. So we can see 1, 2, 3. Coming from the superficial palmar arch, we have 3 common palmar digital arteries. And these are going to anastomose with palmar metacarpal arteries arising from the deep palmar arch. And they go on to supply the digits via proper palmar digital arteries. So we can see these here. We've got our common palmar digital arteries, and they are going to give rise to these palmar digital arteries, as we can see here. And these are going to supply the tendons and the distal digits. The superficial palmar arch unites with the radial artery to complete the arch. Remember, that's done via this superficial palmar branch here. If we look at the radial artery wraps around the lateral aspect of the wrist and it runs along the floor of the anatomical snuff box. So we can see the radial artery here. It's then going laterally and it's going within the anatomical snuff box, and then it's passing between the heads of the first dorsal interosseous muscle. It then passes into the palm of the hand by going through the heads of the first dorsal interosseous muscle. It continues medially across the base of the metacarpals. We can see the base of the metacarpals here. And it unites with the deep palmar branch. So here we can see we've got the deep palmar branch again coming off the ulna, and this is uniting with that continuation of the radial artery. And this forms the deep palmar arch that's running all the way around here. We now have 2 complete circuits. We have 2 complete palmar arches. We have the superficial palmar arch, which is coming primarily from the ulnar artery, but connects to the radial. And we have the deep palmar arch that is coming primarily from the radial artery and is in connection with the ulnar artery. The deep palmar arch gives rise to 3 palmar metacarpal arteries. I mentioned these arteries in the last slide. And these anastomoses we can see here are palmar metacarpal arteries. We can see these anastomosing with our common palmar digital arteries. So again, as these common palmar digital arteries are supplying the digits, they're having an input from both the superficial via the common palmar digital arteries, and they're also having a contribution from the palmar metacarpal arteries. So these digits are then supplied by both the superficial and the deep palmar arch. The deep palmar arch, which we can see here, also gives off the princeps pollicis artery, and that passes towards the thumb, and then it also gives off the radialis indicis artery that specifically goes to the index finger. So we can see we've now got all of the digits and the thumb covered by these digital branches that are coming from either the superficial or the deep palmar arch. So in this lecture, we've reviewed the blood supply to the upper limb, looking at the blood supply to the axilla, the arm, the forearm, and the hand. We looked at the axillary artery, its 3 divisions and branches, and anastomoses around the scapula. We then looked at the branches coming from the brachial artery, specifically the profunda brachii, and some collateral branches that supplied the elbow. We then looked at the ulnar and radial arteries, the recurrent and collateral branches forming anastomoses around the elbow. We looked at the blood supply to the deep musculature via interosseous branches, and then the 2 carpal arches, very briefly, the palmar and dorsal coming from the radial and ulnar arteries. We finished by looking at the superficial and the deep palmar arches. These are supplied by the ulnar and the radial arteries to supply the digits of the hand.